Today I had a very young patient in OPD who had been diagnosed with recurrence of her cancer. So she was a CA breast patient, young, fit, who had completed treatment around 8 to 9 months ago, and on the routine PET CT scan a very small disease was detected in her lungs. So technically it becomes a recurrence of the disease, right? So recurrence, and because it has come in the lungs, not in the breast again, so it is a stage 4 cancer, the recurrence of cancer. So the family, both she and her husband, were upset, and obviously the scenario was very bad and sad, and I was counseling them. So the fear factor was so high because the disease has come back in spite of the maximum treatment, the best treatments. So here is a video about recurrence of cancer. What is recurrence of cancer? What can we do to prevent it? And how to face the recurrence of cancer? So recurrence of cancer means you have received your treatment once and you have been under regular follow-up. There was absolutely no evidence of disease left in the body on the routine scan. But on the follow-up scan, if there is any small disease coming back, that is called recurrence. This is the simplest way to understand. So that is the reason we do follow-up. Especially the first 5 years after the treatment completion, the regular follow-up advised by your oncologist is very, very important. These follow-ups are done to ensure that even if there is a recurrence, we catch it in early stages, meaning in early tumor burden. The tumor should be very small in size, and that's the best way to catch them. Then these small recurrences cannot be caught otherwise, because these small tumors are not going to have any symptom. The cancer does not speak until it becomes big and presses the nearby structures, causes some symptom, cough or blood in the cough, and if you wait for the symptoms to come and then get yourself checked, it might be sometimes late. So the regular follow-ups are very, very important. The PET CT scan and the other tests which are advised by your oncologist should be done regularly. Now here, the recurrence, I would like to throw light about the recurrence. Recurrence, let me tell you again my golden statement: all cancers are not same. All recurrences are also not same. Yes, my dear friends. See, as opposed to a patient where the recurrence is all over the body, suppose the disease has spread to brain, lung, liver, bone, kidney, all the places, versus a patient where the disease has spread to only one organ, suppose only lung, and that too it's a very, very small disease, less than 1 centimeter or less than 2 centimeter, just 1 or 2 lesions in the lung, right? As opposed to a patient who has spread all over the body. These two patients are called as recurrence of disease, and they are actually labeled as metastatic disease, that is the stage 4 disease. But do you think that both the scenarios are same? No. The tumor burden is a very, very important factor. The patients in whom the disease has spread all over the body, the tumor burden is high, definitely they are the ones where complete cure, or I should say the response to treatment, is doubtful. Again, we have a lot of very, very nice options wherein even in such cases we get very good responses, but the treatment responses are not that great when it has spread all over the body, right? As opposed to a patient where the disease recurrence is so tiny, and that too only at one place, this patient is definitely going to do well because the tumor burden is low, and if the patient is fit, young, there are no comorbidities, no liver kidney problems, no heart disease, nothing else, this patient will definitely do well. Now again, this is a general statement, and if you see the guidelines in the medical literature, definitely they say that once the recurrence has come, the scenario is bad, and the timelines they say few months, few years and all that. But there is a lot that you can do to have a continued response to prevent the recurrence of disease, and that is what I am going to speak to you. Now, all recurrences are not same. If the disease is small, you are in a better situation. Just imagine, if the monster is small, it can be shut down immediately and quickly and easily. As opposed to if the monster is big, it takes more energy, more drugs, more time, and sometimes the bigger monster may be difficult to fight. So idea is to catch the monster in the small stages, in the small size. So routine follow-ups are very important. Now, how to prevent recurrence? Now, technically speaking, recurrence is not preventable, but what can you do to at least delay the recurrence is something that we can look about. Now, recurrence depends on many factors. Recurrence depends on the biology of the disease, how aggressive was the disease, and did you complete your treatment on time well, are you under constant follow-up. These are the factors which will determine recurrence. But recurrence is a natural history of cancer. Yes, natural history of cancer is to recur. The disease is going to come back, but when and how long, that is what that makes different for different cancers. Some cancers recur very fast, some cancers do not recur very fast. So some can come even within 6 months or 1 year of completion of treatment, whereas some cancers do not come even for 5 years or 10 years. So it depends upon the variant of cancer, what are the high risk features, what are the good prognostic factors, what are the bad prognostic factors. So recurrences are to a certain extent predictable, but there is a lot that we can do to prevent recurrence, and that's where the Innermbbs framework is going to help you. So we see that even after completion of treatment, and even if when there is no disease found in the PET CT scan, still our patients will be afraid, fearful that, oh my god, what if the disease comes back, the disease coming back, am I cured doctor, am I fine doctor. All these worries are constantly there in few of the patients. So this constant worry and fear is creating the stress environment in your body, and this stress and fear and worry environment is not good for your inflammation. So this inflammation in the body increases when there is increased stress because of our negative thoughts and the worrisome thoughts about the cancer. So there's a lot that you can do to control your negative thoughts and your worry and fear. So if we follow the Innermbbs framework and activate our inner healing by working on our mind, body, breath and soul, the true inner doctor sitting within you, your recurrence chances will definitely reduce, because now you are not focusing on the cancer, now you are focusing on your wellness. What you focus on grows. Where attention goes, energy goes. So focus and give your energy on the wellness, on the good things, on the positive things. The more you focus on becoming healthy, becoming well, and all the holistic practices, the more you are creating a beautiful garden of environment in your body, a beautiful immunity, a beautiful functioning DNA and inner healing, which will definitely prevent the recurrence and keep you healthy in every single way. So all the best, my dear friends. Do not worry about the recurrence. Worry or take care about your wellness, and your true doctor Innermbbs is with you always. Thank you.